it's my pleasure to be here, and it's a privilege to, not be introducing all the other guys because you've done a great job. So I think we'll move straight into what the session's about, and even prior to doing that, I don't think that the guys on the dais, except for me, actually do need an introduction. So. Last mile in India, essentially, when we talk of the payments infrastructure, appears to me as being slightly broken. Yeah, there are lots of challenges, a whole lot of research which has been done, and we'll talk about that research as we go along. What is it that will ensure that the last mile actually gets to work? Is what we believe is that a lot of people who get attached to the payment grid, as we call it, the grid, will be the people who receive money for the first time. And we believe that most of the first time recipients receive money from the government. So schemes of the government, it's likely to expand the payment grid like we haven't ever seen it before. But if that's going to happen, one of the reasons why we thought the last mile was broken was that there were not enough transactions happening. What will drive those transactions? Again, if people do get the money, then they will start transacting at the last mile. Secondly, I think it's also important to go out and define the last mile. What do we mean by the last mile? So as of now, if you see the PMJDY, they have about 126,000 agents at the last mile. Now, having 126,000 agents for about 650,000 villages, which means that essentially one agent for every 4 or 5 villages, is that enough? Are we going to be able to still push these guys to say you go walk 8 or 10 kilometers or more to reach that last mile agent and transact? I don't think it's feasible to do that. On the other hand, when we see the newer entities which are coming up, which is like the payment banks, are they going to change this? And from what we've heard and read and engaged with the payment banks, Airtel alone today has about 300,000 agents in the country, which is more than what the PMJDY had gone and done, and more than the branches of the banks. Right, so it's in terms of physical infrastructure, it's today the largest bank. Is that going to change things on the ground? So we don't know the answers yet. I think it's still early days. We'll have to wait for a few more months, then other payment banks start coming on, and see how it moves on from there. But having gone and said that, I think we are at a stage where India's gone and developed its public goods in a way which is very, very engaging and encouraging to say that it's likely to work. We will not in this debate enter into is UBI good and should schemes be designed around that or not. And I'm not going to enter into that debate here on this panel. But here essentially it's for the last mile. And we certainly sort of believe that India has got and created 2 highways which will help in move this entire piece. And the first highway is the payments highway. So India's got NPCI, which is a nationally interoperable switch, which makes processing and transfer of money very easy. The other highway is the identity highway, where you know who's going to be the recipient of the funds. Right? So these 2 highways, when they start interacting, it starts being an innovative space to be in, and it starts doing a disruption of a lot of things we had gone and created in the past. But having gone and said that, when you start to design the new schemes, these will need to be kept in mind, that how they will change the way those cash payments which were up to the past will be delivered in the bank accounts of the people which access in their hands. I think having gone and said that, I'm going to open up the session. I'm going to first talk to Karthik and ask him about his presentations. He's got a presentation to make. Yeah, and I'm sure he'd also talk about his often discussed RCTs in Andhra and how that impacted and the lessons from that as well. in terms
I
of.
don't have slides on that, but I can.
But I think you should be, because I think there is a key impact there, that it by digitizing it, how does not just the government be impacted, but also the end consumers impacted, and therein lies a tale of the rent seekers versus what they want to communicate back up the channel versus what actually the people want to communicate. So we should also be a little bit wary about what we hear and read instead of seeing hardcore research results. So over to you, Karthik. And the way we'll run the session is that we will start with presentation. So there is a presentation from Karthik. There is a presentation from Sita. And then, yeah, so Krishnan is not doing a presentation, but then Sanchita is doing a presentation as well, and Anshek is also doing a presentation. You're going to talk. Okay. So we have Krishnan and Anshek Shah who's going to talk. So essentially, we are saying about 10 to 12 minutes.
Thanks. So I think, this talk will be a little bit of a hybrid, discussing some themes from last time, and then in terms of implementation issues, I'll discuss that more at the end. So I'll do this quickly, and I think it is useful, again, in the context of the discussion last time, to go back to some basic frameworks and facts that are useful as we think about the cash transfer debate. And in particular, I'm going to take you back to Public Finance 101, which is often forgotten in all of these discussions, which is this distinction between public goods and publicly provided private goods, okay? And now, the core of public goods is that these typically deliver social value that exceeds the cost of providing them. And that's because there are these huge coordination externalities: defense, law and order, public health, water and sanitation. So these are things that individual people with cash cannot and will not do. And these are things that you need the government to do, right? The problem is that there's also this other huge category of spending, and rather than going into merit versus non-merit, I just prefer to think about this as publicly provided private goods. And these are essentially, the rationale tends to be redistribution for the most part. The consumption is usually private, though there may be some spillovers. And I will in fact include sectors like education and healthcare in this. And in fact, Jay Panda did refer to this, and I'm going to give you some data from that, but you'll see why I'm classifying all of these guys over here. And I think the main point to highlight is that India is a historic outlier in all of human history, which is the only country that had universal democracy before development. And what that has meant is that from the inception, we've had political pressures to spend public money on redistribution before you spend on the public goods. And so what that means, and this is completely rational, what you would predict from a democracy. And so there's nothing wrong about that per se. The problem is that the Indian state, therefore, has committed to doing a lot of redistribution before it has the capacity to, in fact, implement that redistribution in a meaningfully, in an effective way. And so what that leads to is that, and this is the data I'm going to share across sector after sector after sector, is that the social value of public spending in India is remarkably low, and that's because the government as an implementing agency is a remarkably effective destroyer of value. And I'm going to show you data on this in multiple settings. And that's where cash transfers becomes an attractive option. So, just thinking about, this is where most of my work has been in the past 15 years, so education is just one. We think about non-merit subsidies, and we think of education somehow as this holy cow, right? How can you not spend on education? Except that when you go look at the efficiency of education spending, that's when you kind of realize how much, here's one line item in one sector, which is teacher absence alone has an annual fiscal cost of 9,000 crores a year, okay? That's one line item in one sector. And that was calculated in 2010, and if you were to kind of look at those numbers post Seventh Pay Commission, that number is probably in the 20,000 crore range. So, and what you're seeing is an explosion of demand for private schools. The share in rural India is over 30%, in urban India is over 50%. Now, they're not much better, okay? So we have research showing that the private schools, low-cost private schools, are not much better, but they do this at about 1/3 the cost, okay? In healthcare, it's the same story. You notionally have a free public healthcare system with qualified providers. If you go look at the household data, over 70% of the market share is with fee-charging private providers who are often unqualified. So again, what is going on, and we've got research from Madhya Pradesh showing that it's not that patients are stupid, it's that, the private guys, even though they're less qualified, make up for that lower qualification with higher effort. And so you end up in a place where the quality of care ends up being comparable, even though they're, for all practical purposes, quacks. And most importantly, they cost 1/4 per patient interaction relative to what you see in the public sector. So PDS, we ran these choice experiments in Bihar where we actually gave people an option of exchanging their food coupon in lieu of a cash transfer. And you see over 80% choose to take the cash transfer. And we got over 50% take up even when the fiscal value of the transfer was only 50% of the subsidy. So that just gives you a sense of how much value destruction there is in the public provision. Okay, so there's strong and consistent evidence of what I'm calling value destruction in publicly provided services. And one striking way to think about this is the following, right? Think about how much money we spend on education, but anybody who can afford to send their kid to a private school goes to a private school, okay? So it's not only that the price of education is zero, the price of education is negative because you provide midday meals, you provide textbooks, you provide a bunch of things that's actually provided by the taxpayer. But what does it say about the quality of your product that you can't even give it away for free? Right? I mean, that's just one way to think about, the abysmal state of service delivery we have. And that's the context in which I think, and I'm glad Jay in particular was alluding to this because he sees this in the field. So the case for cash, I think, so I partly agree with Montague, partly disagree, right? So I agree with Montague when he talks about public goods in terms of infrastructure, when he talks in terms of water and sanitation that are the true public goods. But it's not obvious to me that you want to be spending more on health and education the way it is currently structured, okay? But there is a strong case, therefore, for thinking about cash in terms of replacing publicly provided private goods. And where this becomes really attractive in the past 10 years is if you think about the one place where there has been an investment in state capacity in India, it's in the capacity to deliver cash transfers. So between Jan Dhan, between Aadhaar, between mobile, you have sharply reduced the cost of delivering benefits through a cash channel relative to delivering those benefits in an in-kind channel. So if anything, I would argue that the cost effectiveness of the in-kind channel has become even worse after your seventh pay commission. Okay, so in general, that's the elephant in the room, which is the public sector salaries are about 6 to 7 times higher than what the market equivalent is. So when you're spending more on publicly provided private services, you're for the most part essentially just paying government employees more, okay? And we've got this kind of stunning and depressing study from Indonesia where the government doubled teacher salaries across the board in 2005, and we went in and did this randomized controlled trial, doubled salary. And the title of that paper is Double for Nothing, okay? Because we get zero impact, absolutely zero impact on test scores, effort, learning outcomes. So essentially, when we talk about subsidies, there's this huge subsidy to government employees that we don't talk about at all, when we think about how we make public spending more efficient. So the way I like to think about cash transfers, and this is terminology that's not, I think Paul and I discussed this together, my colleague Paul Niehaus, and they now use this very, very regularly. And I think about cash transfers as the benchmark for any newly proposed social policy expenditure. So just like in finance, the financial investment revolution was Bogle and Vanguard in talking about the index fund of investing. The index fund of development, should be cash transfers, which is you might have an investment, a public investment that has a positive public spillover, but the burden of proof needs to be on the guy who wants to spend the money that way, with cash kind of being the default alternative. Okay, so having said that, so I'm going to skip this, all right, because this is stuff Abhijit already covered. But I do think it's useful to reiterate this one key trope that you hear about cash transfers, which is that people don't spend it well. And we can really kind of slay this holy cow right now, okay? So Abhijit had one bullet point on this, and I'll put a full slide. So this is Evans and Popova's meta-analysis on the impact of cash transfers and spending on temptation goods like alcohol and tobacco. And if anything, the effects seem to be negative, okay? That when you get the cash transfer, you spend less on these demerit goods. And the basic psychology of this is that most of the consumption of alcohol and tobacco is as an antidepressant. It's not because people are, it's not like people want to go mess up their lives. It is the antidepressant that they use. And so, in fact, the cash transfer seems to reduce spending on this. And here's kind of a much more, carefully done RCT in terms of measurement of a lot of these things, and the Give Directly RCT basically finds zero impact on alcohol, tobacco, and gambling. So having set that stage, let's kind of get very, very deep into one specific reform in India, which is these cash transfer reforms in the DBT in the 3 union territories that have been happening in the past year. So this has been a contentious debate, and the government, I think, cautiously tried to get the ball rolling with these UT experiments, partly because they're small, partly because they're urban, partly because they're directly controlled by the union government, and so these are pilots that they could run. So what we've been doing at JPAL is supporting the government just through a series of ongoing field surveys of just process implementation. I mean, this is not the way I would have set it up because it's not randomized. We can't do any impact evaluation on nutrition or consumption or anything, but all we're able to do is at least go and measure process and saying, how is this working out in the field? And so we've done multiple rounds of field surveys, and this is still kind of shared within the government only, but I'm just giving you the headline results. And the headline results, which is kind of both a note of caution and a note of optimism, is that, over time, what we're seeing is a steady increase in beneficiaries' stated preferences for DBT over PDS. Now, so that's the cautious optimism. The caution comes from the fact that there's still non-trivial implementation challenges. And if you look at the first 6 months when people were asked, only 1/3 of beneficiaries actually said they would prefer the DBT over PDS. And that's because these last mile implementation problems are very real. So over time, the government has been using our data to try and tighten up its implementation procedures. And when we went in the last 3 months, you now see that this is up at about 65%. Okay, so that's the positive part. But just to give you a sense of how non-trivial the implementation issue is, 22% of beneficiaries say they don't even know if they've gotten any cash. Okay, because the money is going into an account. It might not be the account that they think it's going to. Maybe it's going to a husband's account. Maybe there's a different account that's seeded. So from the government official records, the money has gone. But from the beneficiary's perspective, they say they haven't gotten anything. Okay, so that just gives you a sense of how this is not easy to fix. And so, the key risks to the beneficiary experience are basically the subsidy insufficiency, the time costs of access, and insufficient information. So here is just specific data on scheme implementation. So you do see that there is steady improvement so the blue bars are the fraction who say yes, they are receiving the payment. And then, the red guys are the ones where they say they're not receiving, and we have proof because we go look at the passbooks and we don't see the entry. But again, it's possible that the money went into a different account and the beneficiary was just showing us the wrong passbook. So from the government's PFMS, the money has gone. Okay, so we're just giving you the disconnect between the beneficiary's experience and kind of what's in the government official records as an example of the last mile implementation challenges. So the good news is this number has been going up, where about 80% now say they're getting the money. So this is another nice slide that highlights this financial access point, okay, which is that if you think about the time cost of accessing PDS versus accessing cash, the orange bars, so the 3 sets are Chandigarh, Pondicherry, and Dadanagar Haveli, and the orange bars are the time taken to access PDS, and then the other 2 bars, the blue one is the time taken to access DBT with a bank or with an ATM. So in all these places, you can see that if you have to go to the bank to get the cash, then the time taken is actually higher under DBT than under PDS. But if you're able to get the cash from the ATM, then the time is smaller. So it just highlights this importance of basic last mile infrastructure, what we would just call, what Nandan would call plumbing, but it's very real. So, I didn't put in slides from AP partly because I thought I had that I would run out of time. But one thing that's worth highlighting from our AP Smart Cards experiments, 2 things. Right? So one is just a rejoinder to Montek that it's in fact possible to do large-scale experiments, which is what we did in Andhra. We randomized the rollout across 20 million people of a government program simply because they don't have the bandwidth to do this overnight anyway. So these experiments are possible and highly recommended. But in the context of financial inclusion, the point I want to highlight in AP is I think we found that the biometrics were highly effective at reducing leakage, but it was the last mile business correspondent that was so important in improving the beneficiary experience. Okay, so the fact that Andhra had invested for 10 years before that in kind of a self-help group-based, village-based business correspondent infrastructure meant you had women who were empowered to handle cash, you had women who were just very comfortable and from that same area, and that made a huge impact in terms of improving the accessibility in the last mile. Okay, so this is not my area of developing it, so I'll defer to others on the panel for that, but I'm just giving you the data to highlight why this is a first order consideration. Now, some further subtle issues with the subsidy is kind of thinking about the comparative cost of rations. And so this is where you see the psychological kind of disconnect when it comes to beneficiary satisfaction. So if you look at this, the biggest source of beneficiary grievance is they think that the subsidy amount is not enough. So the DBT transfer they're getting in lieu of the PDS, they will argue is not enough. And this is a calculation of the deficit spending. And you see that once you take out the out-of-pocket spending and the entitlement, the last line gives you the excess expenditure per household. household. So under DBT, households are spending more relative to what they got in the PDS. So this would feel like DBT is kind of not quite working well, except if you then look at what they say about the quality of the rations, right, they will consistently report that the market rations are of higher quality, right, I mean, than PDS. So what is happening is there is a quality price substitution, like, I mean, that's happening on the gradient, but psychologically, like, you know, people don't make that connection. So psychologically it is that, you know, I'm not happy because the subsidy transfer is not enough. But if you look at the usage is shifting towards a higher quality. And the stated usage is very consistent with the MP results and the other results is, you know, that they do claim that there has been a big increase in dietary diversity, both in terms of the kinds of commodities consumed and the quality. So, but of course, this is just stated preference and we don't have an RCT for impacts, but at least prima facie, it seems like, you know, the cash is being used for diversity. So the most important kind of thought to leave you with is just the beneficiary stated preferences about what fraction of people say they prefer the DBT over the PDS. So it's literally a head-to-head comparison. And you kind of see, so Dadra Nagar Haveli started in the second half of last year, so that's not there in the first period. But you see in the first period in both Chandigarh and Pondicherry, that was only about 33%. So only about a third of the beneficiaries said that they would prefer the DBT. But over time, like, I mean, that number has kept going up. And Pondicherry is particularly interesting, right? Because Pondicherry is a case where they side-by-side have both PDS and DBT. And the reason is that the government of Pondicherry provides an extra 10 kilos of rice on the state budget. So what happened was the central allocation to PDS shifted to cash, but the state allocation remained in kind. So you kind of have a side-by-side beneficiary comparison of both of these. And Pondicherry now 77% of people say that they prefer the DBT to the PDS. Now, so there are two important points here, right? I mean, there's cautious optimism that you will eventually get this, but it also highlights the challenge of the transition path. That if you try to make this transition across the board, you know, like you will probably get massive political pushback, right? Because the beginning, like, I mean, these implementation issues are very real. So what am I going to say about implementation? I have only one slide here because I'm going to defer to Krishnan and others like I mean on actual building out last mile infrastructure. What I'm going to highlight more is from a policy and research perspective. How do we find a way to make sure that implementation is working, right? So, and the biggest problem for any government doing any reform is trying to figure out what on earth is going on in the field. And we at JPAL, you know, we keep fielding these requests from the government, whether it's PDS, whether it's fertilizer in multiple sectors, that they come to us and saying, we want in 15 days some analysis of what's going on in the field. And this is impossible. It took us 1 year of work and 3 or 4 people in this room spending a lot of time over the course of the past year to give you this kind of insight. So what we've been thinking about is how do you build a scalable architecture for high frequency monitoring of what's going on in the field. And one of the things we've kind of realized is the mobile part of the JAM infrastructure is being underutilized. So, you know, the government has call centers for grievance redressals, but what we've suggested is that we just make this an outbound call center where you're able to reach beneficiaries on a random sample every day and just document, like, I mean, what the implementation experience is. And so this is what we did in the last quarter. So the first 2 quarters, we did field-based surveys. The last quarter, we did phone-based surveys and also did field to kind of verify how that lines up. And check for the bias, because when you go by phone, you can't reach, say, 20% who don't have phones. So you can compare the field outcomes for those with and without the phones to see how biased you are by not doing that. So, so this is kind of stuff we're excited about, because even with these 715 households, we basically find that this was a cost-effective and insightful tool to monitor scheme implementation, that it's highly feasible to implement with good mobile seeding. We got an 80% success rate with scripts that, again, the team here developed, Burak, Simoni, Bhuvna, I see everybody here. And then the important point is that when we go verify with the field surveys, when we cut the field survey responses by whether the respondent had a phone or did not, we are not seeing any systematic difference in that right now. Now, of course, this might not hold everywhere. This is a small sample, but at least prima facie, it gives you some confidence that you're not going to completely be missing the picture if you rely on this kind of phone-based high-frequency monitoring. So one of the things we have proposed, which I just made this presentation at the Niti Aayog yesterday, which there seems to be a lot of acceptance of, is going forward with the next wave of these DBT experiments, that we'll try and build this call center from the very beginning, and we can even do a randomized controlled trial of using the data from that to improve performance by following up like in a subset of places, and just do an implementation experiment saying, are there low-cost ways, like I mean, of improving implementation? And this is going to be broadly relevant to DBT implementation quality in all sectors. So to kind of wrap up, like both in terms of my presentation and the larger theme of the conference, I think, there are 2 points which we've made very forcefully. We believe this quite strongly, and Clear Seva does this as well, that the UT experience suggests cautious case for optimism. The preferences improve over time. But when the department has been asking states if they're interested in DBT and PDS, in general, they are nervous, and understandably so, right? So I think governments would be remiss if they were not risk-averse about big changes, right? Given the centrality of food security for the poor. And so it's essential to de-risk the process of policy experimentation. So one of the things we've been talking about for the last 4 or 5 years, I think Seva did this in Delhi, we did this in Bihar and Rajasthan. These are all very small pilots. But we really do think that the right way to make progress on this agenda is to provide beneficiaries with choice, so that essentially people keep their default entitlements, but you work out a choice-based architecture that allows people to opt out, for a cash equivalent. And so that does many, many things for you. It insulates you from implementation risk. So as the implementation improves, people get to see what happens. It insulates you from political risk, from ethical risk, from left-tail judicial risk. So as long as nobody can be worse off, in this particular pathway, that has to be the way that we do this as a socially conscious kind of democratic structure for experiments. And I think over time, why do we give beneficiaries a 1 in 5 year vote on this complex vector of attributes? When we now have the capacity to give them policy level votes on how they want the money spent, that is being allocated in their name. Okay, so in our Bihar pilots, like I said, we saw 80% take up. In Rajasthan, the take up was only 40%. And ironically, what happened was Bihar, we found that women were much more able to leave the village and go to these banks because most of the men are migrant workers anyway. So the empowerment on travel was actually higher than we thought. And Rajasthan, that turned out to be a much bigger issue. Because the distances were larger, the density of ATM coverage was lower, and women being able to leave the village on their own, was much harder. So the point is, India has more people than the entire Western Hemisphere put together, okay? That's North America, Central America, South America put together. To sit in Delhi and somehow think that we're going to have one policy solution for the country is complete madness. So it's not just moving towards state-level experimentation, it's moving all the way towards decentralized, democratic, choice-based experiments. Now, the problem is the government will push back because the department thinks about their role mainly as an administrator and not somebody looking at beneficiary welfare. So the first thought the department will say is, how will I manage the logistics of getting the right amount of grain to the shop if I don't know how many people are going to take up the grain, right? But in the end, that is not what should be determining how we choose policy. And we're now working on ways in which, we can do smaller choice-based pilots in urban areas. So this is what we've recommended, and I think the leadership of Niti agrees, and this is one of the things I hope to do, with my quasi-insider hat now, to try and push a little bit. So my last slide, coming back to this larger UBI conference, I think there's 3 broad approaches. There is one which I consider more the Bardhan Joshi economic survey approach, which is really not to do with leakages in individual programs, but it's much more a broader political commitment to shared national prosperity, right? That's kind of the way I read that larger macro narrative of a UBI, which is you have an indexed UBI, you do need to rationalize several existing schemes for fiscal space, but the political and ethical narrative here is this is a vehicle for shared national prosperity, right? And I think that's very, very attractive. The problem is when you want to rationalize these existing schemes, and that's what I think Ranana was asking Shudipto at the break, is what are these 900 schemes, right? It's easy to say that they can be rationalized. The problem is every one of these schemes exists for a very particular political reason. So typically it will be, some problem in some area and some MPs asked to come up with a solution, and some will go to minister, the department will come up with a particular program for, say, tribal welfare in 3 Naxalite districts, okay? So each of these individual programs had its own logic. So the process of rationalizing that, my view, is not non-trivial. The second approach is to take a scheme-level approach, okay, with state-level pilots, which is what has been happening. You don't make a political commitment to UBI per se, but you say let's rationalize sector by sector. This was being done for LPG. It could happen for kerosene. It could happen for take-home rations in the ICDS. It could happen with the PDS. So this is more feasible in an opportunistic way, and choice-based pilots can be powerful as a way forward. Now, my problem with this, or rather my concern with this, is each individual pilot might fail for last-mile reasons, okay? Because the last mile is kind of a cross-cutting fixed investment regardless of which individual vertical you're trying to reform. So my personal preference is kind of a hybrid approach, right? Which is to start with a very small UBI or WBI, as kind of Jay nicely rechristened this, right? A widespread basic income. But if it's a small amount, what it does is it builds the implementation capacity, it builds the last mile infrastructure, it builds consumer understanding of what it means to have a bank account, it builds that financial inclusion. So I think the India Policy Forum last year, the paper we had, I think Tarun Ramadorai wrote a nice paper for us on just from the Indian household debt survey. And what was striking is that the median Indian household has zero financial assets, right? I mean, so there's a reason why assets are held in land and gold, because viscerally people understand that that's something they can see. The idea that your assets are sitting in some kind of thing in the ether is a really big conceptual leap for people to make. So you can start small to build the last mile infrastructure, to build the comfort level. And then for any given program, a simple way of implementing this index fund idea of development is to say, let's say the government says we're going to increase take-home rations, or somebody comes up with their next favorite program. Then you go and say, okay, let's run this program, and then let's also give people the option of cash. And then you're building this architecture for an item level referendum, and that will set the standards of saying, because cash is always going to be possible, that helps you pivot, like I mean, towards a more cash focused approach to social protection. So let me stop there and hand over to folks who will talk more about last mile implementation.
Thank you, Karthik.